much time in trying to raise awareness.
Thank you very much. I'll answer that question one moment. I just wanted to thank all of you for inviting me here, and what a wonderful organization that you have here, and I appreciate it very much. I was a neonatal nurse working at Joe DiMaggio Children's Hospital right down the street here, and all of a sudden in 2009 we had so many drug-addicted babies on our unit that none of us could figure out what was going on. These babies go through physical therapy because they're so stiff. They go through speech therapy because they can't suck a bottle. They go through the pharmacies trying to adjust their medications. They're on morphine and clonidine every 3 hours to help them through withdrawals. These babies are born withdrawing from drugs. And the neonatologists, it goes on, and they're on our unit 2 and 3 months. Many of them go into the foster care system, which again is pitiful as well, and they have a life of home to home, and either that or they might go home with parents that are addicted to drugs, and then the DCF system is completely overwhelmed, and that's why you hear of all these deaths from neglect or that kind of thing. So we didn't know what was causing this, and then my friend, her son overdosed. The hospital called her down. She went down. She had been doing tough love with her child. And these people are trying everything. Some of them try tough love and their children die. Some of them try doing everything they can and they're enabling and they get labeled with that name and their child dies. So there's no right answer as far as that goes. It's not the parents' fault, but their lives are completely destroyed. So anyway, Blaine told Renee that anyone could just walk into a pill mill. I don't know if you are familiar with that term. Pill mills were proliferating in Broward County. There was 150 pill mills when I started STOPPNow, just in Broward County. Broward County is the epicenter for the entire nation on the opiate epidemic. They were coming from Appalachia, from New York, from the whole northeast coast was coming down here. We were called the Oxy Express. And these kids were walking out of these pill mills with, it was 3. It was oxycodone, it was Soma, which is a muscle relaxer, and Xanax, which is the anti-anxiety. All day long, every single patient was given those 3 pills in exorbitant amounts. So in 2010, they did pass legislation that stopped dispensing because they could just walk out of the doctor's office with all of these pills. So that did help somewhat, but at that time, there were 7 deaths a day just in Florida. And they used the analogy that if manatees or dolphins, 7 a day, were washing up on shore, people would be outraged. You might have heard that. Well, these are human beings, and no one's outraged. The death toll now in Florida, because they wouldn't listen. I've been writing letters. I was holding protests out in front of the pill mills. I've been to Washington, D.C. I've been to Tallahassee. The death rate now in Florida is 16 a day from overdose. The babies that were born addicted last year in Florida was 4,000. Wow. It's up 1,000% since the start of this epidemic. So we have to do something. I'm sorry, I've got a little bit of a sore throat, so excuse me. I have on the back of my card, as Brother Don was just intimating at, that don't wait for somebody else to do something. It's a phrase by Edmund Burke, and it says, all that is necessary for evil to triumph is for good people to not do anything. And there has been a lot of that. So I wrote the book called STOPPNow. It does have some personal stories, but it's not all personal stories, or you wouldn't be able to read it. It does have facts, but it's not all facts because you wouldn't be able to read it. But it talks about the corruption and the greed that is also involved in this. I did get legislation last year. I had a representative write a bill for me, added it to a bill that was going to limit opiate prescribing. I mean, one of the problems, and they've been blaming for years, that people go home and it's their medicine cabinet. It's your medicine cabinet that's causing this problem. So let's have less in the medicine cabinet. Somebody goes home from an operation or an injury, they're giving them a 30-day supply of these pills. So the proliferation of pills is all over, so it's so easy to get. And then it seems innocent because a doctor prescribed these. So that's part of the problem. So I tried to get a limit of 5 days. I really wanted 3, but Representative Carrie Pigman said to me, I think we can get 5 days if we put this through. So it did pass the House. And then Good Friday of this year, it was in March, Senator Jeff Clemens from West Palm Beach, 3:47 p.m., deleted that portion of the bill.
Can I ask a question?
Yeah,
Who was opposing the passing of these bills? Who in general was opposing it?
At the time, the FMA was opposing it,
What's
which
the
is the
FMA?
Florida Medical Association. And also, the drug companies are the biggest lobbyists. And they're paying the politicians for the bills that they want passed. But Jeff Clemens deleted that portion of the bill, and about a month ago, I don't know if you saw it in the newspapers, he resigned because he was found sleeping with a lobbyist. That one was not a drug lobbyist, whether that's his MO, and that was a reason. I obviously don't know that, but there's a lot going on right now, which is kind of good that this is coming out as to why David fighting Goliath here is not winning the fight. I don't know if any of you saw the 60 Minutes. There was a good show this past Sunday, and there was one about a month ago, too, about the whistleblower from DEA, Joe Ranazzisi. I have spoke to Joe Ranazzisi. He's a good guy. The DEA, they are trying. All we have is DEA and law enforcement, and they are trying to stop this. And back in 2014, I did go to Washington, D.C. I did show Marsha Blackburn. I was in her office, and I showed her what's flying off these shelves down here. I had the court documents from DEA versus Walgreens. And I said, you can't pass this bill. Well, they were being paid, and they did pass the bill that tied the hands of the DEA. They can't just walk into a pharmacy and start to inspect their records and go for a licensure removal. They can't do that now. But after that show on 60 Minutes, so this is why it is so good that this is in the news, that people are getting involved, that people know about it, and they're not apathetic about it. They are trying to overturn that bill. Senator Joe Manchin and Claire McCaskill, and that is in the U.S. Senate, has filed the bill to rescind that so the DEA can go in there. I've been to parish priests, and they all tell me, yes, we're doing a funeral every week for 20-year-olds. Kevin, if you don't mind my saying, Landmark Funeral Home. He said they've had more overdose deaths in the last 2 years than they have in the previous 20 years together. So this is, we have to get involved. If you'll read my book and pass it around, you'll at least start the process. I also have on my website, which I have given bookmarks out to everyone, I have the bills that we're trying to get passed. And HB 21 this year, and this year there is a difference. The FMA has agreed to this. And they shouldn't be in charge of the politicians, but I'm glad they're agreeing to it. And Governor Rick Scott did declare a state of emergency. So we have a lot of pressure on our side this time. And they are trying to put through a 3-day limit on acute opiate prescribing during the acute phase. We also, in 2011, we passed the PDMP, which is Prescription Drug Monitoring Program. It's the database that doctors before, or any prescriber, because now PAs can prescribe and that, so the problem's getting bigger, must go in and check that database before they write this prescription. So how that helps is if people are going to one doctor and then going to another doctor, they can go in there and they can say, look, you know, you just told me that you have severe headaches and I feel for you, but you were just prescribed this last week by the hospital down the street and we're not giving you any more. So it was passed in 2011, but it wasn't mandatory, and the physicians don't use it because it's not mandatory. So that will help. It will also help, it'll be a useful tool once doctors get used to it, because if someone's on Xanax and they don't want anyone to know they're on Xanax, it was innocent, but they had an injury and the ER doc is asking them what you're on, and they say, oh, nothing. Xanax and oxycodone together, they are both CNS depressants. So this is why, again, in the height of the pill mill, when they were giving everyone that came in all of those pills, the respiratory system shuts down. So it's important for the doctor, once he gets used to doing that, he can say, look, I know you're on Xanax, and I'm going to give you another type of medication, an anti-inflammatory. That will help you, and it won't cause less of a severe injury to you, as if respiratory depression is an injury. So anyway, what we're doing now is trying to get legislation passed. At one time I was out there in front of the pill mills, carrying signs and bringing attention to it. And back then, they had, excuse me, back then, as I said, there were 7 deaths a day. They were very, very blatant. There was a taxi cab driving all through town. Office visits, $250, Roxy's $3. Roxy's or oxycodone. Driving through town like that. They were so blatant about it. 10 pages on the New Times, that used to be that free newspaper. Yeah. Dr. So-and-so has left, no questions asked. No Florida license required. We don't check. Come in. So they're much more careful now. They're not as blatant as they used to be, but they're still there. I have the ME's report from, excuse me, from 2016, which just came out, because it takes that long for all the counties to get their figures together. But the occurrence of oxycodone increased by 28% last year over the year before. And deaths caused by oxycodone also increased by 28%. So you are hearing a lot on the news about heroin and fentanyl. Most of these would not have gone and bought heroin, but once they become addicted, they have to have it then. So if we could stop the overprescribing of the oxycodone, because 8 out of 10 heroin users start on this not so innocent pain pill, then we could do something about the new addictions. I don't know what, I'm sorry, my time limit is about?
You got 2 more minutes.
2 more minutes. Okay, does anyone have any questions for me? Yes.
Yeah, do you have figures, not necessarily from out-of-state people who come in here to buy, but on the people in the state of Florida in an age group, over 65, because I have a friend in New Hampshire who is working with programs up there. They're very, very bad in that state also.
Yes, it is. I think they're number 2.
But I was amazed at the incident of the over 60s as against teenagers. It was mind-blowing. It was higher,
Yes.
much higher.
At one time, and it's a close second now to the younger generation, but at one time, the highest was the elderly population that are on Medicare, because they fall and break a hip, or here, take this, here, take this. And they call it by a kinder name. They call it dependent on rather than addicted to. But that was the highest rate of deaths, was the elder population, and they're still very high.
Hi, this is so fascinating to me. Well, you said the governor declared a state of emergency, and so did the guy in Washington with the red hair. Declared a state of, what exactly does that mean?
It's supposed to get more public funding. And
Has it?
Well, we do need more beds. There is some money, but it's borrow from Peter to pay Paul. And a lot of the states are suing the drug companies now for the money. I mean, when I was writing letters, it wasn't doing any good telling them about the drug-addicted babies. And I was like, you can end the national debt. Do you know the difference between a 2-day in and out delivery and a baby that's on our unit 3 or 4 months? It's like $900,000, and there's so many of them.